In this video, we'll discuss about herpes virus. What is the morphology? It is a double-stranded DNA virus. It is a enveloped icosahedral. So, double-stranded DNA enveloped icosahedral symmetry. Replication takes place in nucleus. See the structure of a virus. This is nucleic acid in center, double-stranded DNA molecules. Around it capsomer, this capsid having 162 capsomers. This is envelope. Envelope is made up of lipid. So, lipid envelope is present between the envelope and this capsid. In between here, a marble structure is presented. That name is called as tegument. So that was about the structure of virus. Double-stranded DNA molecules surrounded by capsid. Once it having 162 capsomer. Then this one is name is called as envelope. In between this envelope and capsid, tegument is present. 8 type of herpes virus, all of them having intranuclear inclusion bodies. Specifically, Cowdry type A, intranuclear lipsuits inclusion bodies present and it established latent infection. So totally 8 types, all of them having intranuclear inclusion bodies. Name is called Cowdry type A inclusions, intranuclear inclusion bodies, lipsuits, and all of them establish latent infection. They causes latent infection. Classification, 8 different types. They are divided into 3 subfamilies. There are 8 types of human herpes virus, 1 to 8. Human herpes virus, it have that name type 1, it have that name Herpes Simplex, Simplex type 1. Human herpes virus 2, it have that virus name Herpes Simplex type 2. HV, human herpes virus 3, it is known as varicella zoster virus. Type 4, it have that name Epstein-Barr virus. Human herpes virus 5, it have that name cytomegalovirus. 6, it have that name herpes lymphomatotropic virus, lymphotrophic virus. Then 7, it don't have any specific name. So it have that name human herpes virus 7 only. 8 have that name Kaposis sarcoma related virus. So totally 8 virus. 1 have that name Herpes Simplex type 1. 2 Herpes Simplex type 2. 3 varicella zoster virus. 4 Epstein-Barr virus. 5 cytomegalovirus. 6 herpes lymphotrophic virus. Then 7 don't have a special name. Then Kaposis sarcoma related virus. 1, 2, 3 comes under alpha herpes virinae subfamily. Then 4 and 8 comes under gamma herpes virinae families. Then 5, 6, 7 comes under the subfamily of beta herpes. So now herpes simplex virus type 1 and 2 together we will discuss. So HSV 1 and 2. This is human body. all of them causing lesion. Type 1 and type 2 also causing lesion. What is the location where it will causes? General rules above the waist. HSV virus 1, human herpes simplex virus 1 will causes above the waist. Then below the waist, that herpes simplex virus 2 causing infection and causing rashes. So HSV1 spread various route. What are the route? It may be direct contact or through tablet from the patient or carrier. It will transmit. HSV2 transmitted sexually or from maternal genital infection to a newborn. How human that herpes simplex virus to we will transmit? This is uterus of that mother. This one is cervix. This one is the vagina having that HSV2 virus. Inside here, that embryo during normal delivery. Okay, during normal vaginal delivery, HSV2 present here presented. So it is presented genital tract of that mother. If mother not treated during pregnancy, at the time of labor, when baby will coming out from that vagina, the herpes virus can enter inside of that baby and causes disease to the baby. That is congenital or neonatal herpes. So it will transmitted through sex from one partner to another, or it is transmitted from maternal genital infection. Difference between HSV1 and 2 virus. This one causes lesion in and around mouth. We already known above the waist. So this one below the waist. So it causes lesion around genital area. This one transmitted by direct contact through tablet. This one usually transmitted sex or infected mother to newborn. Then this one replicate poorly in chick embryoplast cell. This one very fast. Then this one is HSV1 is sensitive to antiviral agent. This one is resistant. Then less neurovirulent. This one is the more neurovirulent. This one infectivity is less. HSV1 is less neurovirulent. In brain, some diseases caused by HSV2. Then less temperature sensitive HSV1, more temperature sensitive HSV2. So these are the important properties. See the difference in location. Here mouth, here genital area. Then different between the transmission. Here through direct contact. This one is through sex. These are the properties. Next one is pathogenesis. What is the pathogenesis of both of them? Both of them causes secondary infection. First one is primary infection. Then second one is latent infection. What is the meaning of primary infection? As soon as virus enter to the body, either to the skin or through the mucous membrane or through the eyes, it will enter and it causes vesicles formation. This one name is called as primary infection. as soon as the day it will enter or the day or next day, it will causes lesion or vesicle like smallpox, chickenpox causes rashes, but lesion usually healing with residual scarring. No complication will happen, but after primary infection, the virus travel through the nerves, through ganglion is known as sensory root ganglia. After primary infection, this virus will travel through nerves. It will reach to sensory root ganglia. So this is virus. This is the site of virus entry, primary lesion. So here this one is the primary lesion. It is causing disease here. It causing disease here. It is going inside. It is this virus will going to inside. It store here. Here it will store in the form of sensory ganglion. It will there in the body remain in latency many years. After many years, the ganglion will be there. Which ganglion? In Herpes Simplex virus 1. Herpes Simplex virus 1 means trigeminal ganglion. Trigeminal ganglion for many years. It is Herpes Simplex virus 2 means it is sacral ganglion. HSV1 means trigeminal ganglion. HSV2 means sacral ganglion for many years. After many years, it will be reactive, means it will form same lesion here. That is form latent infection. That is 4 things. What are the 4 important things? First one is that virus will enter skin or mucous membrane. The virus multiplication will happen. Then lysis of cell. It produced vesicles. Then it produced ulcer. So virus multiplication. Second, after multiplication, it will enter sensory nerves, going to the sensory root ganglion. HSV1 means trigeminal ganglion. HSV2 means sacral ganglion. Depending upon that virus, it after many years, due to traps of immunity, it can be cold, it can be fever, it can be anything. So reactivation will happen. It produced same kind of vesicles. Again, after many years, it known as latent infection. Suppose this is virus, this is skin. As soon as virus entry to the inside of that body, it will multiply. And lysis of the cells and produce a lesion here. This is the primary vesicles. This is primary disease. After multiplication, this virus travel to the nerve root and reaching inside ganglion. Then if it is this one, HSV1 means trigeminal ganglion. HSV2 means sacral ganglion. Okay, then so virus for many years here only in the form of dormant virus. Dormant means inactive form. Dormant virus. Trough in immunity because of various reason. Drop in immunity here, then reactivation of virus will happen. Some virus can travel to retrograde manner reach skin again and causes various lesion. It is known as latent infection or secondary infection. That is the properties of both HSV1 and 2. HSV1 means above the waist. HSV2 means below the waist. Then incubation period 6 to 8 days. Then diseases. Oral facial lesion, then herptic lido, then it will causes eye infection, nerve infection, visceral infection, then genital infection, because of mainly HSV2. So what are the diseases it will causes? Oral and facial, then lesion in finger, it is known as herptic whitlow, then eye infection, visceral infection, genital infection. So many infection, all of them caused by HSV1 and 2. Next, coming to laboratory diagnosis. Specimen include vesical fluid, skin swab, saliva, corneal scraping, biopsy and CSF according to the site of involvement. Depending upon that site of infection, specimen may be anything. Four things. First one is we will do microscope. So second one is virus isolation. Third one is PCR method. Fourth one is serological method. So first thing here, microscopic method. Microscopy here, special smear in herpes virus. That special smear name is called as Tishank smear, only for herpes virus. This Tishank smear only for herpes virus. Here take specimen and prepared smear from the lesion. So this one is the lesion. Vesicle means from the lesion, the base of the vesicle, and stained with 1% of aqueous solution of toluidine blue O for 15 seconds. How we will prepare? This one is the vesicles. Take fluid and transmit to the test tube. It is the specimen. After we will collect it, we prepare that smear stained with toluidine blue O 1%. Wait for 15 seconds. The smear formed here, it is known as Tishank smear. So what you will see in this smear? Three important things. Syncytia, then ballooning. Third one is Cowtry type A intranuclear inclusions. So three things we can see here. First one is syncytia. What is syncytia? Multiple cell fusioning. Here what is syncytia means multiple cell fusioning here each other, multiple cell fusion with each other. So here gained cell are formed, that is called as syncytia. Here multi cells are formed, so it is called as syncytia. Second one is ballooning. So normally virus will enter normal cell, here ballooning. Third one is Cowtry type A type A intranuclear inclusion. This one is only here intracellular that inclusions bodies is presented. So this one is the microscopic special smear, name is called as uh, Tishank smear. So first here multinucleus gain cell is presented, then ballooning. Third one is inside intranuclear inclusion bodies is presented. Cytoplasm, nucleus, then here this one is the inside intranuclear inclusion bodies. These are the three important things presented in Tishank smear. Second one is virus isolation. How do virus on tissue culture? This is the vesicle. Inside vesicle fluid is present, so excreted fluid into a test tube, then takes cell line. These are the live cell line. Then put your specimen to that slide cell line. You can see the three things. What are the three things? Syncytia, ballooning, and Cowtrate type A intracellular inclusion bodies. These three things presented in virus isolation method also. Third method, PCR, polymerase chain reaction, one of the best method isolate genetic of virus because it containing double standard DNA molecules. So genetics of virus, double standard RNA virus. Then last one is serology. Take patient blood samples, not vesicular fluid. Here take blood. Here we want to search antibody against antigen. Suppose this antigen enter patient body, means that antibody. Here we want to detect antibody by using ELISA technique. So these are the four type of isolation method. First one is sample collection, microscopic method, virus isolation method, then polymerase chain reaction is the best effective method. Last one is serological method. Then what are the treatment? Acyclovir. This one acyclovir, then vencyclovir, then famiciclovir. These are the antiviral drugs is available. Acyclovir, vencyclovir, famiciclovir. Then Boscarnet drugs also available. Trisodium phosphonate, that is called, the drug's name is called as Boscarnet. Thanks for watching.